Hi, it's Dr. Andy with your daily COVID-19 tip, tip number 8. So today's tip is to trust your doctor to order the right tests, okay? So what does this mean? I wanted to give this tip partly in response to an article I saw. I'm actually going to read what they had to say here recently. And I've been talking a lot about antibody tests with employers and some other people to explain their use and why they can be useful for some things, but for a lot of the things people are hoping they're useful for, they're not, or they're not yet at least. So here's this statement. It was an article that was talking about antibody tests being wrong a lot of the time. It says, for example, in a population where the prevalence is 5%, a test with 90% sensitivity and 95% specificity will yield a positive predictive value of 49%. In other words, less than half of those testing positive will truly have antibodies. Now, if that sounded like a lot of gibberish, I don't blame you, because it sounded like gibberish to me until I learned it like 3 times. I had learned it in medical school twice, and then during my residency and Master of Public Health degree. So, I get it. So let's talk about it a little bit, because I think this is actually one of my favorite things to teach medical students, so I'll try to contain my excitement. It talked about a positive predictive value. What does that mean? Well, the predictive value means the chance that my test result is right, basically. So I go out and I get tested and I get a positive result. That doesn't mean that I'm positive for whatever it says. No test is perfect. What I need to understand is what is the predictive value that is correct. So if it's positive, we call it the positive predictive value. If it's negative, we call it the negative predictive value. The chance that my negative test actually means I'm not sick, and the chance that my positive test actually means I'm sick, okay? That's why you need a doctor to help you interpret those results. And that's why I've been concerned about the widespread testing that's been going on, possibly without people having a good understanding of what those results mean. Could be a problem. Sometimes we need the data and we just need people to get tested, and I think that was really important in this case, but there are some concerns with that. Let's talk about those numbers that they just gave us and what that means and why it may only be accurate half the time if it says we have antibodies, and why a good doctor can actually still use that to your advantage or their advantage. So a test has characteristics. We're going to call test characteristics. We call them sensitivity and specificity. The sensitivity means how good it is, how sensitive it is at picking up people that are sick. So how good is a test at finding sick people? So these are the red people. We have 20 of them, and they talked about a test with 90% sensitivity. So if we have 20 people here, that would mean that, and it would correctly identify 90% of them. It sounds pretty good, right? So 90% accurate, that's pretty good. That means we're going to be wrong for 2, but the other 18 we got right, okay? Now we also have to talk about the specificity. And that means when somebody doesn't have the disease, how good is it, how accurate is it at identifying them? So if we had a 95% specificity, then that means that if we had 20 people here, it would get them all right except for 1. The 95, that sounds pretty darn good, right? How does that come across as 50% then? Here's why. Because this disease, say that 5% of the people have it. Now, most likely, I mean, that's actually pretty high prevalence for a lot of diseases. But in terms of this, it's going to end up being low and be a problem. So say we test everybody. Only 5% of the people have it. So here are my 20 people, and there's 1 sick person in there. Of course, I don't know which one is sick, so we test them all right? Now think about it. If I test all these people and only 1 of them sick, most of these, 19 of them, will be like this category here. So if I'm right 95% of the time, and I have 19 people here that aren't sick, I'm going to be wrong on one of those, okay? Let's say I was wrong on that one. Now, as with a 90% sensitivity and only 1 person that's sick, it's pretty likely that I'm going to identify them correctly. So let's say I got them correct, all right? Good. Now the problem, though, is that means I had 2 positive tests. All I know is that I tested everybody and I got 2 positive tests. Turns out that only 1 of them was sick. So my predictive value of that positive test was about 50%. My positive predictive value was 50%, all right? So I got 2 positive tests, 1 of them was right and 1 of them wasn't. And so if you come in and I give you the test and you're positive, I can tell you, hey, you got about 50% chance that you have this sickness. That doesn't sound right, does it? But actually that's how it is working. Now, why can a good doctor still use this test and make sense out of it? The reason is because we did this, we said we're going to test everybody. Prevalence is 5% across everybody. Now, a good doctor, in the right clinical setting, they'll come in and they'll say, I'm not going to test you, you don't have any symptoms. I'm not going to test you, your story doesn't line up. I'm not going to test you because I don't think you're sick. I'm not going to test you, that doesn't sound like it was COVID-19. And maybe it gets down to there are just 4 people left. These 4 that we say, yep, you have some symptoms, your history lines up. Now, that 95% of these 3, I'll probably be right. And that 90% of this one, I'll probably be right. So now, with the doctor using the history and the physical exam to decide who they're going to test, it's very likely that test is going to be correct. Very high percentage now. So that's why you need to trust your doctor to order the right test and interpret it correctly. And that's your tip today.